Dural venous sinuses. The dural venous sinuses are the space in the cranium which lies between the two layers of the dura mater. The two layers of the dura mater are the outer endosteal layer and the inner meningeal layer. Then the characteristic of dural venous sinuses, it is lined by the endothelium, that is by the simple squamous epithelium. Then it have a no smooth muscle in the wall. There is no valve. The dural venous sinuses absorb cerebrospinal fluid through the arachnoid granulation. The dural venous sinuses communicate with the veins outside the skull through the emissary veins, which maintain the equilibrium of the venous pressure within and outside of the skull. The next one, the classification of the dural venous sinus. The classification of the dural venous sinus, that is divided into two, paired and unpaired. The first of all, the paired dural venous sinuses are the first one, the sphenoparietal sinus, then cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus. These are the paired dural venous sinus. Then one more, that is a petrosquamous sinus. The unpaired are the superior sagittal sinus, inferior sagittal sinus, straight sinus, then occipital sinus, then basilar plexus of veins, then anterior intercavernous sinus and posterior intercavernous sinus. Once again, the classification of the dural venous sinus, there are of two types, paired and unpaired. The paired are 18 number, that is cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparietal sinus, petrosquamous sinus and middle meningeal vein or sinus. Then the unpaired venous sinuses are the superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous sinus, posterior intercavernous sinus and basilar plexus of veins. The next one, that is the cavernous sinus. The cavernous sinus is the largest dural venous sinus and it is divided into number of cavernous or spaces by the trabeculae. And it is situated in the middle cranial fossa, that is on either side of the body of the sphenoid. And it is about 2 cm long and 1 cm wide. The formation of the cavernous sinus. The cavernous sinus, the floor is formed by the endosteal layer of the dura mater and the roof, medial wall and the lateral wall, that is formed by the meningeal layer of dura mater. The next one, that is the extension of the cavernous sinus. Anteriorly, it extends up to the superior orbital fissure and posteriorly up to the apex of the petrous part of temporal bone. That's all about the extension of the cavernous sinus. The next one, relation of the cavernous sinus. The structures outside the sinus, that is anteriorly it is related by, that is by the medial end of the superior orbital fissure and the apex of the orbit. Posteriorly by the apex of the petrous part of temporal bone and the crus cerebri of the midbrain. Then inferiorly it is related by the foramen lacerum and the junction between the body of the sphenoid and the greater wing of the sphenoid. Then laterally it is related by the temporal lobe of cerebrum and the trigeminal ganglion. The next relation, that is superiorly it is related by optic chiasma, optic nerve, internal carotid artery and anterior perforated substance. Then medially it is related by pituitary gland and the sphenoidal air sinus. So that's all about the relations outside the cavernous sinus. Then structures related to the lateral wall of cavernous sinus are the oculomotor nerve, trochlear nerve, and the two divisions of trigeminal nerve, that is the ophthalmic and maxillary. Then the structures passing through the center of the cavernous sinus are the internal carotid artery surrounded by the sympathetic plexus and the abducens nerve. The next one, that is the tributaries of the cavernous sinus. From the orbit, the tributaries are the superior ophthalmic vein, inferior ophthalmic vein, and the central vein of retina. And the tributaries from the meninges are the sphenoparietal sinus, then the frontal or the anterior trunk of middle meningeal vein, then the facial vein. From the facial vein, the defacial vein, pterygoid venous plexus, emissary vein communicate into the cavernous sinus. Then the brain, that have two tributaries, superficial middle cerebral vein and the inferior cerebral vein from the temporal lobe of cerebrum. So that's all about the tributaries of the cavernous sinus. The next one, that is the cavernous sinus drains or communication. The first one, the cavernous sinus communicate into the transverse sinus through superior petrosal sinus. The next one, the cavernous sinus is communicate into the internal jugular vein through the inferior petrosal sinus. Then the cavernous sinus is communicate into the pterygoid venous plexus through the emissary vein. Then the cavernous sinus is communicate into facial vein through the superior ophthalmic vein. Then the right and the left cavernous sinus is communicate through the anterior intercavernous sinus and posterior intercavernous sinus. Then the cavernous sinus is related, they communicate into the superior sagittal sinus through the superficial middle cerebral vein, and the cavernous sinus is communicate into the intervertebral venous plexus through the basilar venous plexus. So that's all about the communication of the cavernous sinus. The next one, applied anatomy. The exophthalmos or the protrusion of eyeball, that is for the pulsating exophthalmos. In the fracture of the base of the skull, the internal carotid artery may rupture within the cavernous sinus, which produce a communication between the internal carotid artery and the cavernous sinus called as a atriovenous fistula. The arterial blood rushes into the cavernous sinus with the pulsating that forces the blood into the communicating vein of the orbit, and the eyeball leads to the protrusion and pulsation of the eyeball. The next one, the thrombosis of cavernous sinus, that causes the septic emboli breaches the cavernous sinus through the emissary vein from the face, scalp and paranasal air sinus. So that's all about the cavernous sinus. The next one, that is the superior sagittal sinus. The superior sagittal sinus, that is situated on the two layers of fall cerebrae, that is present on the upper margin, and it is formed by the union of the meningeal vein of crista galli, and that is terminated into the right transverse sinus. Then formation, meningeal vein from the crista galli, and it is terminated into the right transverse sinus. The next one, inferior sagittal sinus, that is situated on the concave free margin of the false cerebrae, that is terminate that by joins with the great cerebral vein of Galen, and to form the straight sinus. The next one, that is the straight sinus. This one is the straight sinus, that is situated the junction between the false cerebrae and the tentorium cerebellum, that is formed by the union of inferior sagittal sinus with the great cerebral vein of Galen. Then it is terminate into the left transverse sinus. The next one, occipital sinus. This one is the occipital sinus, that is situated on the attached margin of the false cerebellum. It terminates into the confluence of sinus. Then next one, confluence of sinus, that is the dilate posterior end of the superior sagittal sinus or the junction of 5 sinus, that is the superior sagittal sinus, straight sinus, right transverse sinus, left transverse sinus and occipital sinus. The next one, anterior and posterior intercavernous sinus. These are situated along the anterior and posterior attached margin of diaphragma cell that connect to the right and left cavernous sinus. The next one, that is the basilar plexus of vein that is situated on the clivus that is connect to the inferior petrosal sinus. This one is the inferior petrosal sinus, and it is also communicate with the internal vertebral venous plexus. The next one, superior petrosal sinus that is situated on the attached margin of the tentorium cerebelli, that is on the upper border of the petrous part of temporal bone, that drains the cavernous sinus into the transverse sinus. The next one, that is the inferior petrosal sinus that is situated on the petrotympanic fissure that terminate into the superior bulb of the internal jugular vein. The next one, that is the sphenoparietal sinus that is situated on the posterior margin of the lesser wing of sphenoid that also drains into the cavernous sinus. The next one is the petroscomous sinus. The petroscomous sinus is situated on the petroscomous fissure that also drains into the cavernous sinus. The next one, this is the transverse sinus that is situated on the attached margin of the tentorium cerebelli at the transverse sulcus. The right transverse sinus that is the continuation of the superior sagittal sinus, and the left transverse sinus that is the continuation of the straight sinus. That's both the transverse sinus, right and left transverse sinus, that is continuous as a sigmoid sinus. The next one, sigmoid sinus that is situated on the sigmoid sulcus, that is the S-shaped sulcus that is formed by the continuation of the transverse sinus that is continuous as the superior bulb of internal jugular vein. So that's all about the dural venous sinus.